Welcome back to my channel. I'm Ken. This is Ken at Large. And today I'm going to give you an example of a exercise routine that helps to lower blood pressure. It involves three isometric exercises, and then I have two regular exercises, a chest fly and a pull down with the lap bar, which concentrates on the biceps. So I appreciate you tuning in, and hit the like button. Please subscribe to the channel, and let's get going. So first I warm up doing 3 Tai Chi type exercises. We'll begin. Do about 20 of these. Then I switch to both arms, 20 again. And then I do leg and upper body, 20 repetitions. Okay, so that's for the warm-up. Now for the little technical difficulty here. What's going on? Okay, sorry about that glitch. Now I'm going to do wall sits. Basically, you squat position with your back up against the wall, and depending on your abilities, that will determine how far down you go. And basically, start off by doing 30 seconds, holding for 30 seconds, and then rest for 30 seconds, and I do 3 sets. So I'm just to show 1 set for each exercise here for the purpose of this video. Basically just holding for 30 seconds. If you're having difficulty going down too far, then just raise your body up. Again, back against the wall, any wall, as a support. Breathe normally during this, and make sure that breathing is going on through each exercise so you don't get dizzy or faint. Now the next exercise is another squat, but it's a free standing squat. So you just get it into the squat position and holding that again for 30 seconds. Again, breathing normally, and also going to what your physical limits are. If you can't go down too far, just raise it up, with a slight knee bend, and then you can progress further down from there. But holding for 30 seconds, and do 3 sets, 30-second rest in between. You do longer if you like. And like that. Okay, so now the last of the 3 blood pressure reducing exercises help to reduce blood pressure, and always seek medical advice before you proceed with any exercise program. I am not a medical professional, and this is not designed to treat or diagnose any medical illnesses. It's just some information, okay? So now the last one is planks. I go on the elbows, 3 sets, hold it for 30 seconds, 30-second rest in between. Again, doing it to your abilities, breathing normally throughout. You may at first experience some shaking in your body, while doing this. That's perfectly normal. It's your body learning, strengthening up the muscles. If you feel any lower back pain, stop the exercise. Any kind of distress you feel, of course, stop the exercise. Again, 30-second periods of activity with 30-second rest in between. 3 sets. Okay, so now doing the 2 additional exercises, which are general. I'm going to work on the chest, doing the chest fly. I do about 15 reps, and the weight which you choose is going to be appropriate for your abilities. The sets I do is 3 of them, and of course the amount of reps, again, you can choose that for your abilities. Simple exercise. I just stand with my arms equally apart and bring them in front of my chest. Breathe normally. And just like that. So again, 3 sets, and you can determine the amount of reps and weight. Okay, so the last exercise, we'll focus on the back, but primarily the bicep. Do a lat pull down with the reverse grip. Again, I do 3 sets, and I do about 15 each set, 15 reps each set. So, grip is about shoulder width, and just pulling down, breathing, 15 reps. That's what I do. The amount of sets and reps, that's up to you. And I'm going to stop here because my having some difficulty technically. It's freaking out with me going up and down with my arms. Anyway, that's an example of a nice, simple exercise routine with focus on lowering your blood pressure. I appreciate you tuning in. Thanks again. Hope to see you soon. Remember, like, share, subscribe. See you next time.